Hello, family. Welcome back to my YouTube channel. I'm Patrick Joy. I love my name so much because it gives me prestige. So, today we are going to talk about, or we'll still be looking at different questions in midwifery. Are you a student that wants to write counsel or any nursing school exam? So these questions are basically for you. So please, if you've not yet subscribed, please do it to subscribe to our channel. What are you waiting for? Because on this channel, we learn a whole lot. We interact, we also educate ourselves. So let's go into the business of today. Today, like I said, we'll be looking at different questions in midwifery. We're going to select the topic and also explain them. So if you have any questions, suggestions, please do that in the comment section. I will respond to each of your questions. So let's go into the business of today. The first question is, which of the following is not a potential complication of postpartum hemorrhage? Which of the following is not a potential complication of postpartum hemorrhage? A. Hypovolemic shock. B. Retained placenta. C. Uterine atony. D. Reduced risk of infection. D. Reduced risk of infection. So I'm going to give us a few minutes to just think through the question. Okay, the correct answer is D, reduced risks of infection. So let's go into the explanation. First of all, what is postpartum hemorrhage? Postpartum hemorrhage is just the loss of blood from the genital tract. It can be up to 500 ml or more. And you know there are two types of postpartum hemorrhage, the primary and also the secondary. So I'm going to do a video differentiating the two types of postpartum hemorrhage, which are the primary and the secondary hemorrhage. So let's look at the option hypovolemic shock. Hypovolemic shock is just a life-threatening condition that is characterized by severe blood loss, which can lead to inadequate perforation of organism and tissue that can cause to PPH. So hypovolemic shock can lead to postpartum hemorrhage, and it is one of the potential complication of postpartum hemorrhage. Let's look at the retained placenta. Retained placenta can lead to complication of postpartum hemorrhage. That is why it is essential as a midwife after delivery you check if there is any retained product of placenta. You check your placenta, you examine it. That is why in midwifery nursing school they teach about examination of the placenta, so as to enable you know if there is any retained product of placenta in the uterus. So that is that for retained product of placenta. Then C is the uterine atony. Uterine atony is just the failure of the uterus to contract properly after childbirth or after delivery. When the uterus fails to contract properly, it can lead to uterine atony, and which will cause postpartum hemorrhage, and it's going to cause a secondary postpartum hemorrhage. So that is that for uterine atony. Then reduced risk of infection, which is the correct answer, is not is not a complication of postpartum hemorrhage, because once there is reduced risk of infection, it will not lead to postpartum hemorrhage. Once there is proper aseptic test techniques, everywhere is sterile, though there will be reduced risk of infection. So that is that for that. Let's go to the next question. The second question is, which of the following is a risk factor for pressure ulcer in hospitalized patients? A. Immobility. B. Frequent repositioning. C. Moisture of the skin. D. None of the above. Let's give ourselves a few minutes to answer this question. Okay, the correct answer is A. The correct answer is A. Immobility. If the patient does not go around, the patient is likely to have pressure or subvessor. A patient that is hospitalized needs to go around, walk around, move around so as to prevent pressure ulcer. So frequent repositioning is not an option. Moisture of the skin and is not the correct answer. Immobility is the answer, is the correct answer. Immobility is just being in a fixed place. You are not going around, you are not stretching around, you are not walking around. It will cause pressure ulcer. So that's for number two. Let's go to question three. Which of the following is not the common signs indicating the onset of labor? Which of the following is not a common signs indicating the onset of labor? A. Molding. B. Cervical effacement. C. Passage of the mucus plug. D. Rupture of membrane. Let's give ourselves a few minutes to also answer this question. The correct answer is A. Molding. It says, which of the following is not a common sign indicating the onset of labor? Molding is the correct answer. Let's go by defining molding. Molding can be defined or can be described as the change in the shape of the fetal head that takes place during its passage through the birth canal. That is molding. It is the change that occurs in the shape of the fetal head during delivery or during the process of delivery. So it is the correct answer. Molding is not a sign that indicates the onset of labor. Onset of labor means before labor, but molding comes during delivery. So it is the correct answer. Cervical effacement and dilatation are common indication for the onset of labor. Cervical effacement is just the shortening of the cervix, while dilatation is the opening and widening of the cervix. So these are signs that indicate the onset of true labor. The next one is passage of mucus plug. Passage of mucus plug is also known as operculum or show, and this happens when there is a bloody discharge coming out from the vagina. So once this is noticed, it indicates the onset of labor. Rupture of membrane is just like when they say the water has broken, the amniotic sac has broken. It is one of the indication of labor. So that's that for number three. Go to question four. What intervention are commonly used to manage pain during labor? A. Pharmacological option such as epidural anesthesia. B. Non-pharmacological techniques like breathing exercise and relaxation techniques. C. Position changes and movements. D. Massage and counter pressure techniques. E. All of the above. Let's give ourselves a few minutes to answer this question. And so E is the correct answer. Why is E the correct answer? Because they said what intervention are commonly used to manage pain during labor. Managing pain, you can use pharmacological option as epidural anesthesia. Anesthesia, all anesthesia are used for managing pain. Then B, non-pharmacological techniques like breathing, exercise and relaxation technique. These are also used for managing pain. Massage and counter pressure technique is one of the techniques used for managing pain. So all of the above is the correct answer. I hope you find this video helpful. Please do like, don't forget to like, don't forget to subscribe and also share our video. So see you in my next video. Bye.